You don't hear about ventilators anymore except in a positive way. We've launched the most ambitious testing effort, likewise, on Earth. The United States has now conducted more than 5.4 million tests, nearly double the number tested in any other country, more than twice as much as any other country. Think of that. Moments ago, I came from a meeting with some of our nation's largest retailers, including Walmart, Walgreens, CVS, Rite Aid, and Kroger. We're joined by the leaders of those great companies, and we also have with us the leaders from the world's top medical diagnostics companies and suppliers, Thermo Fisher, LabCorp, Quest, U.S. Cotton, and the American Clinical Laboratory Association. These are great companies. These private sector leaders, along with others such as Roche, Abbott, Becton Dickinson, Hologic, and Cepheid, have been exceptional partners in an unprecedented drive to expand the state's capabilities and our country's capabilities. The job they've done has been incredible. The testing that's been developed and being developed right now has been truly an amazing thing. I want to thank Abbott Laboratories for the job they've done. I want to thank Roche, and in particular, those two have really stepped forward. Abbott with a 5-minute test that people can take, and in 5 minutes they know what the answer is. I'd like to ask, if I could, the executives of these great companies, and they have really helped us a lot over the last 45-day period. We're talking about a 45-day period when many of us met, and since then what Walmart and the others have done has been nothing short of amazing.
New tonight, some hospitals in the mountains are returning to elective surgeries after postponing and then canceling many of them due to the coronavirus. News 13's Caitlin Penner spoke with one man who says that he's been waiting now to get his gallbladder taken out. She's joining us live, and Caitlin, he says that he needs this surgery right away.
Yeah, Brian Osborne told me that he wasn't going to the hospital because he was concerned about the coronavirus. He says he was in so much pain last week that he went to the ER at Mission. Doctors told him that his gallbladder was inflamed, but surgery would have to wait.
Doctor came back in and she said, your gallbladder is full of stones and it needs to come out.
Brian Osborne says he and his doctors have been working for days to get a surgery scheduled at Mission Hospital. He says he's had to wait in pain.
There's nobody here with me. If this thing ruptures, it's a wrap. I'm done.
Mission leaders say over the next 7 to 10 days, they are phasing back in services and procedures that were temporarily suspended due to COVID-19.
So we know that there's a large number of community members who have delayed their care.
They say they will keep visitor protocols in place and that they have adequate personal protective gear.
It is very safe to come to the hospital and far more dangerous to put off your care.
Pardee Hospital started doing some elective surgeries today, also keeping their no visitor policy.
We typically will do somewhere between 40 and 60 surgeries a day, Monday through Friday. So there's quite a few that are backlogged.
The hospital's chief medical officer says their new plans are subject to change.
I have told the surgeons, if we see a surge or there is something that happens that puts the resources of the hospital at a strain, then we'll reevaluate this immediately.
Advent Health says they are bringing back some surgeries on May 4th. That same day, they are also bringing back all in-office procedures. They will continue screening and masking all people who come into their offices, and all patients will have a COVID-19 test 3 days prior to the procedure.
A new study using cell phone data from across the country shows North Carolinians are getting restless and doing less social distancing compared to a month ago when the state ordered the stay-home order that was put into place. News 13's Kimberly King is joining us live tonight in Weaverville. And Kim, people are getting a little cabin fever.
Frank, that's an understatement, but here in Weaverville, the whole area for the most part is shut down. These are all merchants. And then at nearby Lake Louise, people are following the distancing rule. But the medical professional that we spoke to today said this trend is alarming and could be dangerous.
The Charlotte Observer's headline on the new study has a question with an all too obvious answer.
Do I have cabin fever? No question about it.
Gilda Gaddy getting her exercise in at Lake Louise, but being respectful of the rule. But the new report shows more North Carolinians are leaving home and driving to other counties compared to a month ago.
Well, I'm not surprised, but as I say, I'm a little concerned.
Well, I think that it's unfortunate that we've gone down.
Grace Barnwell is a nurse practitioner at Mercy Urgent Care West.
To a 45 out of 100, that means that our social distancing isn't very good at this point.
The study from the University of Maryland reports 45% of the population now following distancing guidelines. This man and woman in Weaverville followed the 6-foot rule. Washington, D.C., the study says, had the nation's best result with 73% of residents following guidelines. South Carolina and Tennessee closer to North Carolina at 43% and 42%.
You will see a correlation then with an increased number of cases. And so what we're trying to do is prevent that spike and large number of deaths.
Yeah, I'm disappointed.
Blaze Shelton taking a walk on his lunch break to get away from his computer at work. He says he and his family following the governor's order, wishing everyone would.
I'm disappointed to hear that anyone might be not taking it as seriously as they were a couple weeks ago.